So welcome back to Voices in Health and Wellness. This is where we speak with leaders and innovators and passionate advocates reshaping the future of healthcare. I'm Andrew Greenland, I'm the host of this podcast, and today's guest brings a powerful mix of clinical expertise and entrepreneurial grit to the conversation. We're joined by Dr. Mila Mogilevsky, Medical Director of Unique Pain Medicine, a thriving New York-based practice that's redefining how chronic and acute pain are treated, with a focus on real outcomes and deep patient care. With 2 locations in Manhattan and Brooklyn, Mila and her team serve a wide range of patients using evidence-based medicine and multidisciplinary approaches to restore function and dignity to wholly help people living with pain. We're going to really talk today about a number of things, but one thing I really want to talk about is the disturbing trends that are threatening the future of small health clinics, because we're all working in our spaces, sometimes quite small operations. And I really want to get Mila's perspective on that. But without further ado, I'd like to welcome you and introduce you, Mila, to the show. And
thank you so much, Andrew. Thank you for having me.
Well, you're very welcome. And perhaps you could tell us a little bit about your role in Unique Pain Medicine and actually how you got into this space, because it's obviously you've chosen a particular path. So always interested to hear how people end up doing the things that they do.
Sure. I think, I would just start by saying that I guess my whole entrance into medicine was a little bit different than others. Before I became a doctor, I was a physical therapist. And so I understood a little bit more about how to manage patients from the standpoint of, a provider who takes care of the patient, not just medically, but also rehab-wise and a little bit more holistically. So the idea and this passion of having, a rehab clinic, potentially working with patients that have chronic pain, was brooding for a long period of time, not just when I started medical school. So medical school was just a natural progression to step it up from providing physical therapy care to providing full, medical care for the patient. But when I was working as a physical therapist, I sort of noticed that, it's this sort of personalized approach that physical therapists do, almost like hands-on approach that a physical therapist use, would be very helpful as a physician as well. And the idea of having my own private practice where I would really treat patients the way I think would benefit them best is what brought me to opening my own clinic. I opened a Unique Pain Medicine almost straight out of residency. I didn't really wait. I really just wanted to kind of, take it to that level. And it was a slow but very steady growth. We started with just me, and then I started adding more providers and more staff to the, to the clinic. And so it wasn't like a fast, dive in, but it was very steady and organic growth. We started with one practice, which was in Brooklyn, just one location, and then pretty quickly added the second location. And as of right now, we're actually thinking of potentially doing a third as well, to sort of encompass, more of New York City area and meet demands of more patients, if you will.
Amazing.
I know, long answer to a short question, but
yeah. And your role in the clinic? You're very much hands-on. I'm figuring in the business. Okay.
Yes.
So what does a typical day look like for you across your 2 sites? And obviously you're thinking about expanding into a third.
Yes.
And how is that going to shift?
Yeah. So, I have, besides myself, of course, I have 3 other doctors. And so there are 2 of us on each side. So 2 people are in Brooklyn, 2 people are in Manhattan. And also we have an anesthesiologist present in both locations for complicated cases or for cases that do require sedations. We do procedures involving injections, and some of them are painful, and those are spinal injections. So to be able to provide patients best experience, we always have anesthesiologists on staff. It's also very helpful because, they have a little bit more intense training should there be a problem or an emergency. And so these guys are always available, not just available, but they're active players in our treatment team. So that's usually what we do. Because of, I think, of slightly different expertise that all of us bring to the table. We have anesthesiologists, we have rehab doctors with interventional pain training like myself. We also have an internal medicine physician who is a sports medicine guy. Because of all those different assets that we all have, we are able to attract slightly different patients. So I would say that myself personally, I see more female patients. Some of them a little bit older, some are younger, but it's just naturally fit for me to see more women than men. And then other people see, like my internal medicine physician tends to attract more patients that are older, medically complex. And the other two physicians attracting a little bit younger. One of our guys really likes marathon runners, and he's very good with sports medicine oriented people. So that type of clientele naturally attracts, naturally gravitates to him. So it's really more like, organically people and following develops as we go.
Really interesting. And obviously you're called Unique Pain Medicine.
Yeah.
So what are the things that make you unique from the more traditional pain management models? Obviously you mentioned you perhaps get a slightly different patient mix. What are the other kind of ingredients for your clinic that make you unique?
Right. So I think the start, when I first started this this whole enterprise, I call it unique because back in 2010, the idea of doing pain medicine was the idea of prescribing opioids, and from the outset, I made it so that this was not going to be about chronic opioid management. That we would try to really treat patients from every angle, and that in doing so, the idea was to try to actually avoid putting people on opioids unless absolutely necessary. So that was the first thing that, in my opinion, was unique because no one else did that. Like I would have primary care doctors call me and say, "Hey, I'm sending you so-and-so, he needs Percocet." And I'm like, "Whoa, slow down. This is not what's happening." They're like, "What do you mean? You're a pain medicine doctor. Of course you're going to prescribe Percocets. Isn't that what you all do?" So that was the first reason why I called my practice unique. And then slowly and gradually we started introducing not just steroid injections that are something that every interventional pain medicine doctor of course does, but we started doing more regenerative medicine, introducing PRP and adipose and also bone marrow stem cells that are now becoming a little bit more mainstream. Also collaborating with other specialists like physical therapists and chiropractors, really trying to get patients to be managed from every angle instead of just saying, "Well, here's your shot and go home and good luck to you." So really trying to make it a little bit more holistic for the patients. We're slowly moving into doing other wellness things like Myers cocktails, NAD, NAD drips, and NAD patches that will provide a little bit more, energy to the patients. So always looking at the avenues like that to see if we could supplement just your general, straightforward interventional pain to supplement that with something else, with other things that will help patients to live better and stay healthier.
Amazing. I mean, it sounds like a very, very comprehensive, holistic approach. I mean, have you got much competition that are able to deliver the kind of various things that you're able to offer your patients?
I'm sure we do. And I'll tell you, even in our building alone, we have three other specialists that sort of, work in the same, with the same population and providing probably similar care. I don't know. I try not to look at others. And I do this on purpose because I feel like, even if you're sort of doing the same thing, you're still doing it in your own way. I think what stands us apart from others, apart from everything else I've mentioned, is that we really try to provide boutique level of care. So if the patient calls in the morning, they're gonna be seen the same day. 24 hours is really something that we push for, but ideally same day. And that's the first thing. And the second thing is that nothing against mid-level providers, but we are not the kind of clinic that puts PAs first in ours. And a lot of times patients go to see a doctor. The doctor is not there. There's a nurse practitioner or PA. And again, not to diss them, some of them are great. But if you're a patient who is going to see a doctor, you should be able to see the doctor and not another provider in their place. So that's I think is another thing that distinguishes us from others. We really try not to cut corners, and if we stand for our brand, if you're coming to see me, you're going to see me. You're not going to see somebody else. To the point that we try to accommodate patients to make sure that they're seeing the provider they wanted. So, for instance, once somebody is sick, of course, another person will cover, but that's an exception rather than a rule.
Amazing. So one of the things we're exploring on this podcast is how smaller patient-focused clinics are being challenged in today's environment. And I just wondered, from your perspective, what are some of the big trends that you're seeing, or even some of the threats that you're seeing in this field?
Oh yeah, I mean, not to sound negative, but I think when I first started out in my space, there were quite a few clinics. Just around in our radius. Then after COVID, a lot of them dropped out. I just assumed that it's because, COVID killed like new guys. But now I see that it's not just COVID, which was horrific for us, but also people are being gobbled up by large organizations. So I'll give you an example. We worked with a quite known, quite famous medical organization called One Medical. You probably heard of them. It's a primary care doctors, excellent organization. We used to, send patients back and forth, and then suddenly they disappeared. And I was like, what happened? And I found out they got bought by Amazon. And this is not uncommon. People get gobbled up. Clinics get gobbled up by private equity, hospitals, and large, huge financial organizations. And this is happening everywhere, and not just our clinics, not just pain management clinic or doctors' clinics. Lots of physical therapy, small boutique clinics disappeared in the matter of last couple of years. Again, got bought by huge organizations. So this is a big threat to a small guy like us. And the only thing that I think we have for us that's always going to be present is that we are not going to treat patients like just another number. I feel the moment that people get bought or clinics get bought by private equity, it becomes all about the numbers. The idea is we'll buy you for $3 million and we'll sell you for $9 million in like 2 years. And so the numbers, the outcomes get pushed, financial outcomes get pushed. And as a result, patients get sort of sidelined. And I think that's something that small private practices still have an advantage in. We can't afford to sideline a patient, simply not, first of all, because it's not right, but also because if we lose one patient, we lose the following. So we fight for every single patient outcome and for quality of care. That cannot be compromised by.
Amazing. I like your ethos. I just wonder if these small clinics that are being gobbled up, is it because the numbers are attractive to them for the proposition, or they just can't make their business work because of rising costs or reimbursement issues or staffing or kind of thing?
Absolutely. No, I don't think it's a number game. I don't think, looking from like where I stand and other, doctors that I talk to that are in private space, there's really no number that would be worth the freedom of seeing your own patients, of running your own show, that thrill that you have when you're doing something you really believe in on your own terms. It's invaluable. So it's not the money. It's more that they just can't stay in competition. Just in our area where we are in Grand Central, we have HSS, we have NYU. We have huge organizations medical organizations right around us that offer the same thing, sort of the same thing, allegedly, and have incredible amount of budget that they can throw at ads and and everything else. So it's rough. But I don't want to sound negative, because I think at the end of the day, a good guy wins. Not that they're bad guys, but I think they're better guys for our patients. And as you alluded before, it's all about, staying on top of the developments, going to conferences, reading, trying to improve every single day, really try to push for good outcomes so that patients benefit. That's really what it's all about.
So this is, obviously you talk about this as something you observe in the industry, but I'm guessing that your operation, do you feel relatively protected in the sense that you have something which will survive and you won't feel that you're going to be gobbled up in the future because of the way that you do things?
I do. I'm optimistic. I think that there's always going to be, a room for an alternative, right? Like if you go to the hospital and you get a horrible care, and not that all hospitals do provide horrible care, but generally speaking, just from what I see, people get swamped in that bureaucracy where nobody actually takes the time to spend time with them because everybody is busy and they're big and they don't care. There's always going to be that alternative. And I think that, we may go through bad years or good years, but at the end of the day, I think what we have to offer will always be sought after. It's just a matter of sometimes, pushing harder, being more creative, being more, looking at things from a different angle. But overall, I think I'm optimistic. I have to be.
Yeah, no, absolutely. I'm guessing this threat is not unique to pain clinics. I'm guessing this really extends to much broader across outpatient healthcare.
100%.
Yeah. Okay. Interesting. So, sounds like things are going well. You've got 2 clinics. You're thinking about a third. What is going well for you right now in the business? What are you most proud of in terms of how you do things?
I think every clinic is based on the team that you have, and I think that we got to the place where after many years of trying different people and having different providers, we are in a place right now where everybody that works works in the clinic works together, and overall it's a very friendly bunch of people. The doctors are young and driven, and they are not as much in competition as they are in cooperation, and that definitely shines through. We are friends, not just inside the clinic, but also outside. We go out, we do things together, and that definitely helps. The staff, I think, is overall amazing, and everybody has that same mentality. Like we need to take it to the next level. We need to try to help patients. We need to call them back if they have a problem. So it's I think that's sort of the secret sauce, right? Be happy while you're at work and try to work together. It is your clinic is what your staff is. So much of it depends on how people feel when they come to work and what they do.
Totally agreed. So is there anything that's particularly frustrating lately in the business? Anything that's keeping you up at night as a practice owner?
Yeah, well, I think, as you said, as you alluded to before, there's a huge competition, and you don't always know why people, you don't always know. You look at the numbers, month per month per month, and sometimes you have good days, sometimes you have bad days, and I think the patience to sort of just say, okay, it's not a day-to-day situation. It's more like a period-to-period situation. Let's compare December this year to December last year, instead of saying, oh my God, this Thursday was horrible. What about like Friday? Is it going to be worse? So you always have those thoughts that you kind of have to put in the back burner and be like, listen, there are good days, there are bad days. What matters is that everybody is doing well. Patients are healthy, no bad outcomes. That's really what it's all about. Numbers at the end of the day, we'll score them. We want to make sure the patients do well.
Brilliant. So I was actually going to come to that very thing about the metrics that you pay particular attention to. I mean, is it patient volume, outcomes, operational efficiency, all of the above, or do you have anything you particularly look at to kind of really get a gauge of how your business is doing?
It really is all of the above. I mean, you mentioned all of it. The efficiency, I think, is something that we need to work better on. It's always challenging. It doesn't take much to get thrown off course, and small perturbations are always there. Patients' outcomes is something we always drive for, and it's not negotiable. The outcome has to be good, or we will lose patients, and frankly, we'll lose our reputation. But the efficiency sometimes it can be improved for sure. The overhead, especially working in a place like New York City, can really drive you down if you overspend, and it's hard not to. This will result in in a quite a bad. I shouldn't say bad, but it would be a challenging month if the overhead is pushed too high up. And as it is, I would say it's at least 75% on a good day.
75%. So what's 75%?
So your overhead, if you
Okay.
gross, I don't know, $100, you take home 25.
Got it. Okay, that's interesting. Obviously, this is a global podcast. I'm actually in the UK, so
Yeah.
we have a slightly different model over here. I obviously do some of the work I do in functional medicine is private based, but I still work in the health system. So one of the values of doing this podcast is getting a real global perspective. So we're just seeing practitioners doing different things in terms of different disciplines, but also we're in different countries. So this makes it all very interesting to hear about, and especially with you being in a very central location in the States, it just really adds an interesting perspective. So looking ahead to the next 6 to 12 months, what does success look like for unique pain medicine?
6 to 12 months, I think it's pretty short, still pretty short period of time. I think that right now, I want to push a little bit harder on getting a little bit bigger following in the city, in Manhattan. Brooklyn seems to have stabilized. Manhattan is still struggling. I wouldn't call it struggling, but still not as solid as I would like it to be, as it was before the pandemic. I don't know what's going on with you guys, but in our case, lots of patients, lots of employees of large financial organizations have not returned to work full time. They're still like in a hybrid model. And our location, specifically to us, our location is in Midtown, where most of it's not a residential location; it's where people work. So we lost a third of the patients that we usually had just because of the hybrid model. And so the challenge is to bring those people back, or to get other sources of to get to know other providers that could potentially send patients from their clinics onto us. So it's about making more contacts with outside disciplines. As I alluded before, we work with physical therapists, we work with spinal surgeons, neurologists, etc. But now I'm thinking, we should probably also work with psychologists. There are people that take care of patients, like acupuncturists, like biofeedback specialists, behavioral health people. That's sort of one of those untapped resources we didn't look into. And you mentioned wellness. I mean, that's all about wellness. And I think that will tie in nicely with us. So sort of trying to do more of that outreach, doing this podcast I think is also a little bit, it's not something I usually do very frequently, but I think it also will sort of drive maybe a lot of another, population of interested patients and clients.
Brilliant. Well, hopefully that'll be the case. That's one of the reasons we're doing it, just to get some visibility. So hopefully this will give some visibility to what you do and your approach and your ethos, which I really admire. And finally, if there's if you had a magic wand and you could fix one major issue in your business today, what would that be? There may be nothing, but I'm just curious to know if there's anything that's like a big bugbear.
Well, it wasn't a magic wand. I would get rid of all the insurances and the regulations and obstacles that they put in our path. But that probably won't happen. But yeah, that would be ideal. Have that freedom away from third-party payers and just have that direct interaction with patients. That would be amazing. But other than that, it's just continue pushing quality and continue pushing high standards of care so that patients respond well.
Amazing. Look, Mila, thank you so much for this, for giving us the time to speak today. Really interesting hearing your thoughts on this conversation, talking about what you do, the passion you have for what you do, and the way that you've made it a really unique offering to patients. And this is completely my ethos. I'm very much about holistic and holistic care, giving patients a good service. And I'm really impressed with what you do. So thanks for your honest conversation. What we'll do, if anybody wants to contact Mila who's listening, we'll put your details on the bio page. So if anybody wants to reach out or look at your socials, we'll put it on to the final page. But yeah, thank you very much again. And
thank you, Andrew.
A really good afternoon, and all of our listeners. Thank you very much.
I appreciate it. Thank you. Thanks, guys.
Okay.